And Dr. Jake Overholt is with us from Swetlic Chiropractic and Rehabilitation, and we appreciate him making that really long drive over here to be a part of the program today. Dr. Overholt, it's great to see your face instead of just talking on the phone today.
Right, yeah, I like this. This is fun.
Let's first off learn a little bit about you. You've been on here before. You've talked with us before, but tell us a little bit about your background and with Swetlic Chiropractic and Rehabilitation.
Okay. Yeah, I'm a Fredericktown boy, so I'm fairly local, and I started working with Dr. Swetlic right out of school. I went to St. Louis for my chiropractic training at a college called Logan Chiropractic College. And so I've been with Dr. Swetlic. We've been together for 13 and a half years, going on 14, so I feel like I'm established here. A lot of people know who I am by now, but yeah, just it's every year it gets better and better, it seems like.
Well, I would cut off the interview right now once you said you were a Freddie and I'm a Centerburg Trojan, but I'll let it keep going. Now, at what point did you decide, hey, this is something that I want to get into, this is something that interests me, and then you obviously went on to pursue it?
When I was in high school, our guidance counselor did a great job of, doing surveys to see what our interests were and what field. And I knew I wanted to go into the health field, but I'm not a big blood and guts type guy. So I felt like chiropractic was an option, and I did some career shadowing with some local guys around Fredericktown, Mount Vernon, and it was a profession that I could see myself doing every day, helping people, but not having to deal with all the blood and everything. So, yeah, it was a better fit for me.
So you mentioned you've been with Dr. Swetlic for many years now. He's a great guy. And I've been over that facility, and I'll tell you what, that's state-of-the-art type stuff over there. Tell us a little bit about the facility, about some of the services you guys offer over there.
Yeah, we've been blessed. Over the years that I've been there, we've really grown in the physical therapy department of our practice. Initially, when I joined Dr. Swetlic, we did chiropractic and we had a small therapy suite, but we were able to move into this larger building up on the corner of Upper Gilcrest and Yager Road, and we have a lot more space to do the physical therapy. We added Dr. Jenkins, our physical therapist, and he's a wealth of knowledge, and just have a lot more equipment and space to do the rehab. And we really like the active rehab, getting people moving, strengthening muscles, balancing muscles. So, I feel like that's where we've grown the most in my time with Dr. Swetlic.
A lot of people hear the word chiropractic and they think, well, you're working on somebody's back and that's it. And then, but at Swetlic Chiropractic and Rehabilitation, we're talking knees, we're talking shoulders, we're talking all kinds of different things that you can help people rehab and improve.
Right, and that's the beauty of our setup. I feel like we can work together with Dr. Jenkins and treat just about any musculoskeletal issue that you can come across. Like you said, it doesn't just have to be the spine, it can be extremities. And the nice thing is we've developed that relationship with Dr. Jenkins, Dr. Swetlic, and I, where we're bouncing ideas off of each other all the time. If we don't know for sure, it's nice to have another set of eyes, another set of knowledge, that we can work together to get people better.
Often people think, well, with the generation that it's just older people that come in there. I've been in there, and I was not quite 30 years old at the time when I came in, just with some back problems. And even Dr. Swetlic would mention to me, he said, yeah, your back is not great right now. And so it can happen for an 18-year-old. You can treat an 80-year-old. It doesn't really matter. It doesn't, what back problems and different things that, it doesn't matter who it is. You'll treat it all right.
Right. And like you said, you get the people with the arthritic conditions. You get the middle-aged working class that are on concrete doing repetitive jobs or sitting at a computer all day. And then you get the young athletes that, nowadays with travel ball and kids playing the same sport year-round, you're getting these repetitive injuries with the younger population, and not to mention some of the postural things that go on with cell phones and tablets and stuff. So, it really is all age groups. And some people don't realize that we treat babies, too. The birthing process is a traumatic event. There's certain things that can go wrong with the spine and neck with having a baby. So.
Yeah. And there are some people that'll be, and I was kind of the same way when I had some back. It's just a one-day thing. My back's just bothering me. I lifted something, no big deal. I'll be okay. And then days go by, and then weeks go by, and you're still in the same situation. How important is it, Dr. Overholt, for you to to once you start feeling pain to get an appointment and get it figured out before it gets too bad?
Yeah, that makes it easier. The sooner the better.
Sure.
It's easier to fix the problem before your body starts to compensate for that injury.
Yeah.
So muscles start spasming or they start weakening. You know, there's different things that happen long term if you let something go. And you're right, sometimes it will self-resolve, but other times it does need some help.
Yeah, and I know that it's almost like retraining your body to be, you know, you can fix something and say, okay, we're going to put this back into place where it is. Then you almost have to retrain your body to keep it in that spot, right?
Right. Yeah. That's where some people fail is, you know, we'll give them certain stretches or exercises to do on their own. It's not just that short appointment at our office is going to fix it. You got to sometimes do your part too. So you got, like you said, retrain muscles, stretch muscles. So there is a responsibility that the patient has to take on for their health as well.
For sure. Dr. Overholt, I want to ask you, I hope this is the last time I ever have to ask this, but in terms of COVID-19 and how you guys have had to adjust and different things, are you kind of back to normal? I know you were doing kind of a 7:30 to 1. Is that kind of still the same situation, or where are you guys at with all of it?
Yeah, we're still operating under the same hours, and part of that is we're still working with a limited staff.
Sure.
So that's something that we meet on a weekly basis, and we just, you know, assess the situation, and we're still carrying out all of the safety measures. We've been able to drop the mask mandate. It's more of recommendation for certain situations, or if a patient wants us to wear one, that we're totally willing to do that. So we do see things starting to progress towards quote unquote normal, but we are being cautious with that as well.
Yeah. And you kind of alluded to the fact that people have to do their part, even probably more in this COVID-19 pandemic, because you probably had to tell them, hey, you're going to be at home. You're not going to be in here as much. You've got to be able to do these things at home. And that, you know, that ability to do those things at home, it can almost make or break the progress that you already have, right?
Correct.
Yeah. So, Dr. Overholt is with us. We're going to be talking about posture. You know, every time, before we were on the phone so you guys couldn't see me, so I would just try to straighten up. But I know we're going to be talking about that here coming up with Dr. Overholt. We do want to thank Tim Hortons Coffee and Bake Shop, Coshocton Avenue in Mount Vernon. It is always fresh. They have great donuts. They have wonderful sandwiches as well. You can stop by Tim Hortons, try their bagels, croissants, their cookies, and their donuts as well. Stop by Tim Hortons today. And it's just down the road from us here. They've got a drive-through and all kinds of options, so stop by and check that out. Dr. Jake Overholt with us, Swetlic Chiropractic and Rehabilitation on the program, and we're going to be talking about some different things here coming up. We're going to take this quick break, though, and come back. More of AM Knox County coming up. Welcome back. It is AM Knox County. It is a Tuesday, and we appreciate you joining us. We're going to hear from Mayor Matt Starr coming up. I did not kick Dr. Overholt out of the studio after learning he was from Fredericktown, that he graduated from Fredericktown, so he's still here talking with us. But you know, one of the things, it was easier when you guys were on the phone, but I love having you guys in here. But it was easier when you were on the phone where I could slouch in my chair. Now I can't do that. Yeah. Let's talk about posture. You know, it's interesting. Posture almost nowadays it's more of a key area because of all this technology we have nowadays. So tell us about the importance of posture.
Yeah, and you touched on it there. There's a lot of people working from home. You know, more are starting to go back, but they had these home computer setups and they were coming in with all these postural issues, spinal issues. So, I mean, it all starts with, you know, it depends on what type of job you're doing and the postures you're doing, but let's say you're in a factory setting and you're on your feet for long hours. That's where proper foot support, arch support gets your foundation right. And then how your posture is when you're doing your job. Are you standing up straight? Are you stooping over? You know, the computers, what type of chair you have. Do you have the lumbar support? How's your, you know, as far as computers, a lot of what your body position has to do with 90-degree rule. So, you know, when you're sitting, you want your hips and back at 90 degrees. You want your knees at 90 degrees. You want your elbows. So there's different setups that get you out of that position and then put stress on certain parts of the spine and shoulders and back. So
Yeah, and you're practicing what you preach. You got a great. Yeah, I'm over here trying not to slouch. It's just really hard because we talked about it before, and your body gets so trained to do these things, and then you just kind of, I'm sitting here, I'm typing away, and then you just start to slouch. And I think Dr. Swetlic told me one time that you actually put more stress on your back when you're sitting than you do any time else, right?
You do. The pressure on your lumbar discs, especially, it goes up when you're sitting. Just the way the weight is distributed, it puts the pressure on the disc. And actually, when discs bulge or herniate, they do so backwards, toward like posterior, towards your back. So when you're sitting, it puts more pressure on that disc, and over time they start to bulge a little bit, and then it weakens, and that's when you're more prone. You go out and bend with a twist to pick up a piece of paper off the floor, and you blow a disc. That's because it's weakened over time.
Yeah. So it's almost like just you do something and you're going about life, and maybe you really do hurt your back, but it doesn't really bother you too much. And then this one little thing, it's almost just one little thing, and boom, now you've definitely got to go see a chiropractor. So the degeneration portion of it as you go through, that's also really big. If you're doing the wrong posture, you're doing the wrong thing for a long time, it's not going to get better.
Yeah, and a lot of times you don't realize it until it's too late.
Yeah.
And so many of us, with sitting at computers and doing less physical work, our core strength, those stabilizer muscles, weaken. And then you don't have that support around your spine either, and you're just more prone to those injuries from that weakness as well.
Yeah. Should you do like stretching or something beforehand? Is there certain things that you should do? Maybe you do sit at a computer for the most part all day long. Should you get up and do anything specific just to make yourself get up and move?
Yeah, I think it's a good idea at least once an hour to get up, walk around, pump fluids in and out of those joints, stretch the muscles. And then I feel like for computer people, working on their core outside of work. So it can be something as simple as getting a exercise ball, a physio ball that you sit on, and doing pelvic circles, pelvic tilts, while keeping a good posture, just to strengthen those stabilizer muscles that you're not using throughout the day.
Yeah, and taking what you do throughout a day, and maybe you're just a regular person that just slouches. I'll tell you what, I'm kind of like that. It's really hard because your body just says, well, I mean, I'm comfortable right here, But can you get to a point where you have that posture and it is still comfortable for you, but you just got to almost train your body to be like that?
Yeah, I mean, sometimes it takes a conscious effort to sit with good posture.
Yeah.
But just like any other muscle in your body, your postural muscles fatigue. So that, like you said, you don't even realize it, but you start to slouch, and that's because those muscles are getting tired. So just working on strengthening those muscles through the core exercise we mentioned a little bit ago. You can start to strengthen that, and then it'll hold longer, and then you don't have to think about it as much.
So you're talking about like doing a bunch of crunches or things like that? That's what people need to do just to help their core? Is that the best thing to do, or is it just eating healthy? What's some of the...
I mean, all of those factors.
Yeah, sure.
And as far as core strengthening, there's different levels. I mean, you can start as basic as you want. Like I said, just simply sitting on the ball and doing pelvic circles, pelvic tilts, that's firing those muscles. But you can get more advanced into like bridging and certain type of balance exercises out of the bridge move. So it can progress and get more difficult, but even just starting with the simple stuff will help.
Yeah. And we talked about it before. You guys do the treatment at first, and then there's the physical therapy aspect of it. So how involved are you? Is it just you send them to Dr. Jenkins and they got the physical therapy side, and so your time is complete, or do you stay with the patient through that time as well?
It depends on the situation. Okay. Sometimes I'll get somebody that I want to work on them as well, because they have this alignment issue that may not be resolved in one adjustment. It may take a series of adjustments. Or sometimes whatever issue they have, it kind of goes hand in hand, treating the skeletal system and the muscular system. So I'll work on them, and then the way we schedule it is they see me, and then maybe they go see Dr. Jenkins for physical therapy right afterwards. Sometimes it's an issue where, there's not necessarily an alignment issue with the spine or a joint, but they do need to work on strengthening this muscle or stretching this muscle, and it's more of a physical therapy thing. So they may just see Dr. Jenkins on their own, but that's the beauty of it. Sometimes it's just kind of on the fly. I might have somebody and it's like, well, this would really benefit from some physical therapy. And I always give the person a choice. Would you like to see Dr. Jenkins, or do you want me to refer you out? Just give them. There's options in town, but I'm partial to Dr. Jenkins because he's really smart.
He's also a great guy. Yeah, he's awesome.
But yeah, that's the beauty of our office is it's a one-stop shop, and yeah, it just kind of depends on the issue as to who they're seeing, but we can refer around.
Yeah, it's almost like, and I like analogies a lot, and it's almost like changing the oil in your car. If you go and one time you buy the car and you just buy the car and you say, well, I don't have to do anything with it. It's just I already bought the car. Nothing you have to do. It's kind of the same way. You don't just get the treatment and then just say, okay, now I can just do whatever I want and it's just going to be fine. It doesn't work that way. You've got to continue to have that maintenance, right? And
that's what I like about Dr. Jenkins is I feel like, initially he's going to take you through all your rehab one-on-one. He's making sure you're doing it right. He's going to challenge you. He's not going to let you get by with slacking. But he's also equipping you for when he's done with you. So he's giving you home exercises, home stretches, so that, when you're done, you can keep doing these exercises to maintain all the progress you've made while working with him.
Yeah. I know it's not your area exactly of expertise with the stem cells. I know that Dr. Swetlic does that. Are you guys, by anything that doing those again? Or are you planning on doing those in the future?
Yeah, they're still doing them.
Okay.
Like you said, Dr. Swetlic heads that up, but we have a nurse practitioner that administers, and she's the one that people consult and work with the most. So yeah, we do have a nurse practitioner that's still coming on a monthly basis.
Very cool. So that option is there for people as well. So I guess just before we wrap up here, maybe there's somebody listening out there that says, hey, I've been really dealing with some shoulder pain for a while. I've been dealing with some lower back pain for a while. What's maybe something you would tell them if they've just said, hey, they've been out there just struggling for a long time, pulling some muscles. What would be something that you tell them?
Yeah, I would say, it's better to be safe than sorry.
Sure.
Come in, get checked out. If it's something we can help, we'll help you. If it's something that we can't, hopefully we can find somebody who can help you. So, I wouldn't deal with pain when there's solutions out there.
Yeah. Dr. Overholt, we appreciate him joining us. Tell us again where you guys are located. Not too far away from here. Stone's throw away. Tell us where you're located and once again your hours that you have right now.
Yeah, we're on the corner of Upper Gilcrest Road and Yager Road. Used to be the Complete Comfort building, but you'll see Swetlic Chiropractic big on the building. But we're right on the corner. Our hours are 8 to 1. And right now, just like any other business, there are challenges with staffing. So if you call and you get a voicemail, that means Cindy is working with a patient right now at the front desk. Leave a message. She'll get back to you when she can. That I know people sometimes get frustrated when they initially may not get to talk. She'll answer if she can. If not, leave a message and she'll get back.
All right. Swetlic Chiropractic and Rehabilitation, great facility. I can vouch for it because I've been over there and they've treated me and helped me a lot. So, and I was one of those people that let it linger for a long time. So don't be like that. But we appreciate, Dr. Jake Overholt, joining us here and chatting with us. And hopefully you guys continue to come over and not on the phone. Hopefully we don't have to ever do that again here in the rest of our lives. But appreciate it, Dr. Overholt, and we'll look forward to catching up with you guys next month as well.